Hi, this is Dr. Eric Westman with Adapt Your Life and Ask Adapt. Today's edition is about keto flu. I think the most important thing you need to know about keto flu is that it doesn't happen for most people. In fact, I would say a third to a half of people have some side effects the first few days or week of going from carb eating and carb burning to not eating carbohydrates and being a fat burner, meaning you go through a transition phase, also known as keto-adaptation, where you're changing a lot of your body's machinery, enzymes, machinery, if you will, so that there's a time when you might get fatigue. So let me put it the other way. A half to two-thirds of people will have no problem at all in this transition. But if you do have an issue, usually it's fatigue or cravings for something that you haven't eaten in a while. You might get headache. And the less common, I would say maybe 1 in 50, 1 in 100 people will get what's known as the keto flu. The keto flu is the name for if the symptoms that you're getting, the feelings you're getting are so bad that you feel like you have the flu, meaning you're full of fatigue, headache, muscle cramps, and some people have to lie in bed for a day or two. It's not common. I hear it in my clinical setting when people come back occasionally. Most often people don't have anything to report as bad as they change to a keto diet, but some people do. Now, we do recommend, in order to prevent the symptoms of transition or keto adaptation, or to prevent the keto flu, that you add back some salt. And the one form of salt is in the form of bouillon, cube, or crystals, or paste, or broth already made up. And most of these serving sizes have about 800 milligrams of sodium or salt. And the purpose of the supplementation of salt is to reduce the side effects of keto flu. One warning: if you have a history of high blood pressure or a history of heart failure, then you do not want to use the extra sodium or salt, because the salt can worsen high blood pressure and heart failure in some people. So if you have no history of heart failure or high blood pressure, you're not on medications, I advise routinely to use 1 or 2 servings of bouillon or broth to minimize your chances of getting symptoms or even keto flu. Nobody really knows what causes the transition symptoms. There's a lot going on in the body to change the way it's metabolizing fluids and salt, and we think that it's the change in the insulin level that allows the body to get rid of the sodium and water, changing the fluid balance that causes the symptoms. That's why adding salt to prevent against excessive salt and water loss early on can prevent or minimize your chances of getting keto flu. So to summarize, most people don't get keto flu. If you are having a symptom now and you don't have medical issues, you're not on blood pressure medicine or have heart failure, try some bouillon. Just mix up a cube or crystals or paste in hot water, kind of like tea, and drink it. If it makes you feel better, then do that 2 or 3 times per day while you're transitioning from the carb eating and carb burning to not eating carbohydrates and being a fat burner. I hope that's helpful. Please subscribe below, leave some comments. Thank you.